The United States has just signed a massive healthcare deal with Nigeria worth $2.1 billion, and the details emerging from Saturday's announcement are creating serious conversations across the country and beyond. This 5-year agreement between Washington and Abuja isn't just about the money. It's about how that money will be spent and who will benefit from it, and that's where things get really interesting. The United States Department of State finalized this Memorandum of Understanding on Saturday, committing nearly $2.1 billion to expand essential healthcare services for HIV, tuberculosis, malaria, maternal and child health, and polio prevention across Nigeria. But here's what's catching everyone's attention. The agreement explicitly emphasizes supporting Christian faith-based healthcare providers. Nigeria currently has about 900 faith-based clinics and hospitals that serve more than 30% of the population, providing critical healthcare in areas where government facilities are scarce or non-existent. These mission hospitals and church-run clinics have been operating for decades, often in rural communities where trust has been built over generations. According to the official statement from the State Department, this agreement represents the largest co-investment any country has made under the America First Global Health Strategy. Nigeria itself has committed to increasing its domestic health expenditures by nearly $3 billion during the 5-year term of this MOU. That's a substantial commitment from the Nigerian government, showing that this partnership requires both countries to put serious resources on the table. The America First Global Health Strategy, which was released just in September 2025, shifts American foreign health assistance toward bilateral agreements with individual countries rather than working through multilateral organizations or the traditional aid agency structure. Now, let's talk about the context that makes this deal particularly significant. The agreement was negotiated in connection with reforms the Nigerian government has made to prioritize protecting Christian populations from violence. This comes after President Donald Trump made headlines last month when he posted on social media that the United States was prepared to take military action in Nigeria to counter the killing of Christians. The Trump administration has consistently highlighted what it describes as global persecution of Christians, calling Christianity facing an existential threat in Nigeria and numerous other countries. Washington recently placed Nigeria back on the list of countries of particular concern regarding religious freedom and has also restricted visa issuances to Nigerians. Nigeria was even included on a United States travel restriction list, which President Trump linked to terrorism concerns and visa overstay rates. If you're getting value from this breakdown and want to stay informed about major developments affecting Nigeria, please hit that subscribe button right now and turn on your notifications so you never miss important updates like this one. Tap that like button as well to help this content reach more people who need to understand what's happening. The timing of this health agreement is fascinating because it shows improved diplomatic relations despite the travel restrictions and other tensions. The dedicated funding will be directed to Christian healthcare facilities that offer integrated services for infectious diseases and maternal and child health. These faith-based institutions are considered uniquely positioned to complement efforts in publicly run facilities and strengthen Nigeria's overall health infrastructure. The investment aims to expand access to preventative and curative services in communities where these facilities have already established trust and operational presence. However, this explicit focus on Christian healthcare providers has raised important questions about equity and inclusivity. Nigeria is a religiously diverse nation with a large Muslim population, particularly concentrated in the northern regions alongside practitioners of traditional religions and other faiths. Critics are asking whether channeling American support primarily through Christian facilities might create disparities in healthcare access for citizens of other religious backgrounds. Healthcare is a fundamental human right that should be available to all Nigerians regardless of their faith, and the implementation of this agreement will need to address these concerns transparently. The United States government has made it clear that this funding comes with conditions. State Department officials stated that the President and Secretary of State retain the right to pause or terminate any programs that do not align with American national interests. The Trump administration expects Nigeria to continue making progress in combating extremist religious violence against vulnerable Christian populations. This conditionality means the flow of these billions of dollars depends on Nigeria meeting certain expectations regarding religious freedom and security. Nigeria has been battling a jihadist insurgency since 2009, a conflict that has killed at least 40,000 people according to the United Nations, including both Christians and Muslims, and has displaced around 2 million people. Violence from extremist groups, farmer-herder conflicts, and banditry have created security challenges across multiple regions. The American emphasis on protecting Christians reflects concern about attacks on Christian communities in parts of Nigeria, though violence has affected Nigerians of all religious backgrounds. This Nigeria deal follows a similar pattern established earlier in December when the United States signed a $2.5 billion health aid deal with Kenya. That was the first such bilateral agreement after Trump dismantled the United States Agency for International Development, the world's largest aid agency, and ordered an overhaul of American foreign aid under the America First banner. The approach shifts away from traditional multilateral aid structures and non-governmental organizations toward direct government-to-government agreements with increased partner country co-investment requirements. For ordinary Nigerians, the practical question is what this money will actually deliver. Similar partnerships typically include training programs for healthcare workers, provision of medical equipment and supplies, infrastructure upgrades for hospitals and clinics, improved supply chains for essential medicines, and technical support for health policy implementation. Nigerian healthcare workers might receive specialized training in areas like emergency medicine, surgical techniques, infectious disease management, or maternal health. Facilities could get modern diagnostic equipment, reliable power systems, improved sanitation, and better drug storage capabilities. The 5-year timeline suggests sustained investment rather than short-term fixes. The success of this partnership will ultimately be judged by whether Nigerians experience real improvements in healthcare access and quality. Past international health initiatives in Africa have sometimes struggled with poor coordination, corruption, misalignment with local priorities, or inability to sustain programs beyond initial funding. Both Nigerian and American officials must implement this agreement with transparency, accountability, and genuine commitment to improving lives for all Nigerians who need better health care.